All right, let's dive right in. Today, we are pushing aside the headlines to take a direct, clinical look at fentanyl citrate. We're going straight to the source material, the medical facts, to really understand what this drug is, how it's actually used in a hospital setting, and the incredible high-stakes balancing act that comes with administering it safely. Let's get started.
Okay, first things first, we need to get a key term down: opioid analgesic. Now, the easiest way to picture this is to think of a key and a lock. Your brain has all these specific locks, which are called receptor sites. An opioid, like fentanyl, is basically a perfectly crafted key that fits into those locks. And when that key turns, it unlocks a really powerful pain-relieving effect. It's that precise mechanism that makes these drugs so incredibly potent.
So that brings us to the big question. In a clinical setting, what is fentanyl? Let's break down its most important characteristics.
This slide really gets to the core of it. First, it's synthetic, which just means it's man-made in a lab, engineered to have a really high potency for those mu-opioid receptors we just talked about. And you'll see it's a Schedule II controlled substance. Now, that's a really important classification. It means that, yes, it has a clear and accepted medical use, but it also has a high potential for abuse, so it has to be controlled very, very strictly.
And this timeline, it shows you exactly why it's so useful in medicine. Just look at those numbers. The effect starts in just 1 to 2 minutes, and it only lasts for about 30 to 60 minutes. So you can see this is not your typical long-term painkiller. It's a precision tool designed for managing severe, short-term pain in very specific, time-sensitive situations. Fast in, fast out.
So, knowing how fast it works, what is its actual mission inside a hospital? What problems is it specifically designed to solve? Let's take a look.
The clinical profile really gives it two main jobs. The first one is pretty straightforward, controlling severe pain. But the second one is very specific, sedation for something called RSI, which stands for rapid sequence intubation. That's when doctors have to get a breathing tube in, and they have to do it fast and safely. The patient needs to be deeply and immediately sedated, which makes fentanyl's super fast onset absolutely invaluable.
But of course, with a drug this powerful, the benefits always have to be weighed against some pretty significant risks. And that brings us to maybe the most critical part of this whole discussion: the high-stakes balancing act that clinicians have to perform every single time they even consider using this drug.
It's the most important question they have to ask, right? So what are the risks involved? Well, the source material breaks them down into two really distinct and important categories. So think of it like this. On one side, you have contraindications. These are the hard stops, the absolute red flags where the drug is just considered too dangerous to use, period. Then on the other side, you have adverse reactions. These are the things that could go wrong, the potential side effects that have to be watched for like a hawk.
Let's look at those hard stops first, the contraindications. These are absolute deal breakers. So if a patient is already having trouble breathing, what's called respiratory depression, or if they have a significant head injury, fentanyl is completely off the table. The risk of making those conditions catastrophically worse is just way too high.
Now, let's look at the adverse reactions. That first one on the list should look pretty familiar. Respiratory depression again. So here's the crucial thing. Slowed breathing is both a reason not to give the drug and a potential side effect of the drug. You can see why this is so challenging. Clinicians have to constantly monitor for slowed breathing, changes in heart rate, even a strange side effect called chest wall rigidity, where a patient's muscles can suddenly become stiff.
And, the complexity doesn't stop there. Fentanyl's effects can get a whole lot stronger if it's combined with other drugs that slow down the central nervous system, like sedatives or muscle relaxants. This is exactly why getting a patient's complete medication history isn't just a formality, it's a critical, potentially life-saving piece of the puzzle.
Okay, so with all of that in mind, how is this powerful drug actually used in the real world? This section is all about fentanyl in practice, and if there's one word to remember here, it is precision. This number says it all. The standard dose is not a one-size-fits-all kind of thing. It's 1 microgram per kilogram of body weight. That means every single dose is meticulously calculated and tailored to each individual patient, right down to their exact weight. This isn't guesswork. It is precise, calculated medicine. And this table just illustrates that precision perfectly. Look, the standard dose for an adult and a child is the same per kilogram. But now look at RSI, that critical procedure for inserting a breathing tube. The dose is suddenly 2 to 5 times higher to get that deep, rapid sedation. And then compare that to end-of-life care, where a much smaller nebulized dose might be used for comfort.
Different missions require totally different doses and delivery methods.
And finally, good medicine always has to account for specific groups of patients. So let's wrap up by looking at the special considerations the profile outlines for pregnancy and lactation.
The main guidance from the clinical profile, as you can see right here in this quote, is very clear and direct. Chronic opioid use should be avoided. But what about short-term acute use, like, say, during labor? Well, the profile notes a few potential impacts. It says it can temporarily affect a baby's heart rate and, in some cases, cause some temporary muscle stiffness in the newborn. But, and this is a really interesting point, the source also notes that when it was used during labor, any symptoms of depression in the newborn were basically the same as what they saw in babies whose mothers received no pain treatment at all. So, yeah, it's a very complex picture that requires extremely careful judgment. So, as we wrap all this up, I think the theme that keeps coming through is pretty clear. In its clinical setting, fentanyl is an incredibly powerful tool. And, just like any powerful tool, its value isn't just in its strength, but in the skill, the judgment, and the absolute precision with which it's used.
And that really leaves us with this final thought. In the world of medicine, fentanyl is a powerful pain reliever and a potent sedative. But more than anything else, its use is always, without a single exception, a profound responsibility. Thanks for joining me for this explainer.